Hello, everyone, and welcome to our conference on the recent scenario regarding a possible brain death. We have this meeting recorded, so if anyone needs to go reference this in future meetings, please see this link. So, first, I would like to begin with some of the medical issues that are present in this scenario. There may be a variety of medical care issues that can come up depending on the severity of the accident. For this case, individuals in a car accident could suffer physical injuries such as broken bones, lacerations, and possibly head trauma. In this scenario, the patient could experience paralysis or brain damage. In addition to the physical injuries, car accident victims also experience mental and emotional trauma such as anxiety, depression, or PTSD. To promote patient beneficence, providers must assess and treat all of these issues in an appropriate and timely manner to ensure the best possible outcome for the patient. This could involve a combination of emergency medical care, surgery, rehabilitation, and ongoing psychiatric support. When a patient is unconscious in an accident during medical care, there may be conflicts that arise regarding medical treatment. As we can see, conflict that can arise is between medical professionals and the patient's family members or loved ones. Family members or loved ones may want to be involved in making decisions for the patient. However, medical professionals must prioritize the patient's interests and make decisions based on medical expertise. This leads to tough decisions and disagreements between the parties involved. We will later discuss how hospital can address these concerns with various hospital policies. Next, we will discuss the potential for survival in these situations. The potential for survival for car accident victims with medical intervention depends on a variety of factors, including the nature and severity of their injuries, quality of medical care, and how fast they get the care. In general, victims who receive timely and appropriate medical care are more likely to survive, and severe injuries will have medical professionals needing to perform emergency procedures to stabilize the patient and prevent future damage. In some cases, patients must be placed on life support or undergo multiple complex surgeries to repair the damage. Finally, there also may be some conflicts that come up with regards to the extent and cost of the medical treatment, as medical providers may need to make decisions about the treatments that are necessary and which are optional, and this can lead to questions about cost and potential benefits of different treatment options. Surviving an accident like this may have a lengthy road to recovery, including disability status, expensive medical bills, and even more conflicts. However, some patients do recover at a faster pace than others, which some would call a miracle. It's impossible to know which patients with similar injuries will have fast recoveries than others. Ultimately, it is important for all parties involved to prioritize the patient's best interests and work together to make decisions that will lead to the best possible outcome for the patient. Next, we will discuss legal brain death. So, legal brain death refers to the legal definition of death that is recognized by the state. States in the United States may vary in their definitions of brain death, with some having specific statutes and regulations that determine the criteria and processes for declaring a patient legally brain dead. In a car accident scenario, doctors are typically required to provide support to an injured patient to stabilize their condition and maintain vital functions. They must provide this care despite what any of the family members think of these medical procedures. Life support may include intubation and medical ventilation, administration of fluids and medications, surgical interventions, and to address life-threatening injuries. The purpose of life support is to provide the best chances of recovery and is guided by principles of medical ethics, prioritizing the patient's well-being and the preservation of life. This is part of the Hippocratic Oath, medical training, and hospital policies. We must also acknowledge any DNR documents This scenario might be different if there were any DNR documents, however, we see that none are present. A do not resuscitate document is a legal and medical directive that allows individuals to specify their wish not to receive CPR or other life-sustaining interventions in case of cardiac or respiratory arrest. In a car accident scenario where a DNR document is not present, medical professionals are typically bound to provide resuscitative measures to an injured person unless we clearly have evidence that shows it would not be against the patient's previously expressed wishes. If a spouse thinks there is a DNR available but is having trouble finding it, you must not acknowledge DNR wishes. You should keep looking for documentation to respect patient autonomy, but cannot take a statement from a family member as an honored DNR. Many patients have different views on DNR policies, and this can vary greatly based on various cultures and religions. To remain unbiased, providers must provide cultural competence and respect all religions, however, not make decisions based on a generalization of a culture or religion. We can see how cultural competence positively affects care when one study reports elderly Latino patients in one pre-post study were more likely to document advanced care plans when they were provided with individualized, culturally competent counseling on advanced directives in their preferred language. This is studied by Atkines in 2021. Providers can also identify when patients are not fully understanding and can involve social workers or translators to cross cultural and language barriers. We will now discuss a power of attorney, which a power of attorney for healthcare is a legal document that designates an individual to make medical decisions on behalf of an incapacitated patient, including end-of-life choices. When a patient is unconscious and lacks a power of attorney, medical professionals generally consult with the patient's kin of family members. However, they should not make decisions based on family members' opinions. We see that ultimately that the decisions of recommended treatment and treatment needs is up to the provider's judgment. Emergency doctors often have to make tough decisions, and one article reports the most important ethical problem faced by emergency physicians in end-of-life care is making ethical decisions on such as whether to perform resuscitation or continue life-sustaining treatment in cases where the patients are not competent to make decisions. This involves weighing the potential benefits and risks of various treatment options and determining which course of action will ultimately serve the best interests of the patients. In many cases, doctor must consider factors such as the patient's overall health status, the severity of the condition, and the potential for recovery when making these decisions. While these decisions can be emotionally taxing, they are essential. They are the essential part of ensuring that the patients receive the best possible care and their well-being is prioritized above all else. By carefully weighing the ethical principles of beneficence and non-maleficence, doctors can make informed decisions that uphold the highest standards of medical ethics and provide the best possible outcomes for patients. We will also must discuss patient autonomy. Some family members are saying in this scenario that the patient would not like to live like this. However, this is an opinion that does not matter as it conflicts with patient autonomy. Ideally, providers like to give control to patients and let the patient exercise control in their end-of-life decision-making, according to the Morelli 2020 study. And it is important that family members are not allowed to make health decisions for a patient because these decisions should be based on the patient's best interests and not the desires or beliefs of family members. Family members may have their own biases or agendas that could potentially conflict with what is best for the patient. This also aligns with inheritance that has been rumored to present in this situation. Additionally, family members may not have the medical knowledge or expertise necessary to make informed decisions for the patient's health. Allowing family members to make health decisions for a patient could violate patient autonomy and their right to make decisions about their own body and care. Ultimately, it is the responsibility of the medical professional to ensure that patients' best interests are prioritized and that decisions are made based on ethical principles and medical expertise. Next, we will discuss some ethical issues. In the car accident scenario, beneficence and non-maleficence are crucial ethical principles that guide healthcare professionals in providing care to patients. Beneficence involves the obligation to act in the best interest of the patient to promote their well-being. This means that healthcare professionals should prioritize providing life support to patients in car accidents to prevent further harm and to ensure they receive the best possible care. Non-maleficence, on the other hand, requires healthcare professionals to avoid causing harm to the patient. This means that they must carefully weigh the potential risks and benefits of any intervention, including life support techniques, before administering them to the patient. In the car accident scenario, this may involve considering factors such as the severity of the patient's injuries, overall health status, and the potential for recovery. Ultimately, the application of beneficence and non-maleficence in the car accident scenario requires healthcare professionals to balance the need to provide life-saving interventions with the need to prevent future harm to the patient. By prioritizing the patient's well-being and carefully considering the potential risks and benefits to any intervention, healthcare professionals can provide effective and ethical care to patients in car accidents. Next, we will discuss hospital policies and resources. So, in a scenario with an unconscious car accident patient with a contentious family disagreements over their care, various support mechanisms are able to play pivotal roles in addressing the complex situation. Life support protocols guide medical professionals in providing the necessary interventions to stabilize the patient's condition while respecting their autonomy and prior expressed wishes when available. Providers in the emergency department must review with this council on a regular basis to ensure they are following the highest standards for quality of care. End-of-life counselors provide emotional support and facilitate conversations between the family members, helping them understand a patient's prognosis and make informed decisions. An end-of-life counselor can facilitate conversations between the family and the provider, remind the patient's family that the patient's best interest is in mind, even if it is not their interests. An end-of-life care counselor does not have to have extensive medical training, but can be a social worker or affiliate of the social work field. This will help reduce any conflicts in the emergency department so that providers can focus on their medical practice. Conflict resolution committees offer a structured platform for resolving disputes among family members and aligning perspectives with the patient's best interests. If a social worker is finding conflicting policies in unique situations, they can bring it up to a conflict resolution panel that can address each situation. This panel can acknowledge any outliers that apply to each situation and find a just way to resolve the conflict while keeping all the parties calm and happy. For example, the family may think they have the best interest of the patient in mind. However, the frequent reminders may be needed to people who are dealing with a very stressful and possibly grieving time. The ethics committee can provide guidance on ethical aspects of care, ensuring that decisions align with established principles and ethical standards. Social workers facilitate communication among family members, helping them cope with emotional distress and offering assistance in understanding the medical, legal, and ethical dimensions of the situation. Together, these support mechanisms create a holistic approach and address the patient's care and family dynamics while upholding the principles of compassion, ethics, and informed decision-making. So finally, we have the works cited. I'd like to thank all of the providers who have attended this forum today, and I wish you guys all the best in continuing to provide the best care for this situation. Thank you very much.